You know what I would love for you is that you would love your job and be paid well and be respected and feel energized doing it for the rest of your days. Are you feeling that currently? Because if you're anything like me, anybody I know in the healthcare field or have known has been through hell. It's not an easy life, and it's certainly not an easy field to work with other humans, let alone people who often, it's very risky work, a lot of pain, a lot of problems, a lot of trauma. What we don't need is more gaslighting of you, asking yourself, why can't I do this? Why aren't I making enough? Or what I used to do, which is, I can't be any good then if nobody's paying me. Yeah, I wasn't clear about my fees or my client base, really. Who's my client? I just thought I can work with pretty much anything. I don't think, there's only ever once, and I'm pretty good at assessing, where I said to my supervisor, I think this is one for you. However, yeah, for me to sort of tap out, yes, there's no words, basically. There's no words. I was 25 and no, thank you. We get to have help. And this is the personal development field. You know, if you're in health, in my opinion, you're in the personal development field. And we only develop when it's fucking personal. So if you're being treated poorly by anyone, I'd take a good look in the mirror and ask what the source of that is. And it will be your judgment of you. And you're accepting things that aren't okay. And this only goes one way when we say yes to being undermined, being ragged, being gaslit, being abused, being disrespected, and so on. It only goes one way, that your clients or your mentees will suffer by default. It's just like being in an abusive marriage and thinking your kids aren't affected. They are. Believe me, I look after them. So, I wonder what you would like to do about it. I don't know, how did I actually end up? I guess just investing and investing and investing and finally deciding that I wanted to be happy, not just talk about it. So, I blew it up. If you know anything about me, you'll know I care. I care about your health, I care about mine. I care about morality in healthcare, and there isn't fucking any, unless it's coming from individuals. Certainly not organisations. I don't know of an organisation that isn't abusive in healthcare. There must be one. Am I overlooking? Let me just check myself. Do you know the one thing that sticks out that I think about, however, I don't know, and it might just be me being romantic, is Underground Railroad. Tim Ballard. And hundreds and thousands, I'm thinking now, of individuals that go and get the kids who've been sex trafficked. And that's what I'm thinking about in healthcare. That's humanitarianism for you. At healthcare, I suppose it could be, loosely, some pockets of it. The rest of it's fucking hideously genocidal, in my very informed 30-year opinion. So if you're a healthcare worker and you're suffering and you're still watching, thank you for your time. This is not personal to you. You're one cog in a very big system. And if you're not feeling good, it's because it's not good. And there is a better way. You get to design it. I will do my best to support. However, to give you a sense, I meet and work with and train people when they decide sometimes if it's the right fit. People who have, like me, been chronically burnt out, prostituted. We prostitute ourselves. However, people will pay us, obviously. Terrifically badly treated. And then our patients and our clients get poor treatment. And it reminds me actually of the nurse, and I forget her name, retired midwife, she calls herself. I saw her being challenged in a comment online, you know, basically, how could you leave midwifery? Because we're still here, basically. And she was saying, I couldn't, essentially my understanding of what she was saying, I couldn't fight for you and be employed by the National Health Service. I couldn't do both. So I left. Your patients and the people you take care of don't need you suffering in order to try taking care of them. I know, because I've been a patient in psychiatric facilities, of course. As much as trained in them and worked in them and developed programs, successful programs in them, I also have been in them as a client here and in the United States. It's fucking horrific. I wouldn't wish it on my worst enemy. And I tell you what I hear often, I am a survivor of the NHS. I must have heard that. Oh, I don't even know how many times those exact words out of the mouths of people on trains, gentlemen, kids, bipolar people, you name it, all kinds of different people. Me too. The worst abuse I've ever experienced, and that I've had some, has been at the hands of the NHS. No apology. In fact, you're welcome for the disclosure. In the NHS, there are some excellent clinicians, obviously. Or I don't know if it is obvious. There is. I've met some. There are also some sociopaths, and a lot of them I've met. Why? Well, big businesses will do that. Sometimes it's a prerequisite to be a psychopath or a sociopath. And often because people hide in plain sight. And the more people like you and I say and do nothing, the more we enable those systems to hurt people like me. And at some point it does have to stop. There's always a revolution in life. This is life. So on behalf of anybody that can't actually say this on the outside of a psychiatric facility, in my very informed, again, opinion, you have a moral duty to do the right thing if you're seeing abuse. And if you're covering it up, I get it. However, you're covering it up and people are getting hurt because you don't have the courage to say no. And I do appreciate you probably have bills to pay and so on. However, this is a call to action to say, if you get well, that means taking ownership of your part, of what you're doing, what you're thinking, what you're saying, what you're feeling. Having a good look at that moral compass of yours, what it's doing, and start doing better. And until you do, there will be people's hearts breaking unnecessarily because you are scared to do the right thing. This is not where this message was going. However, this is where we're ending up. I guarantee it that you will be rewarded if you do the right thing. If nothing else, you will respect you when you look in the mirror because you know you took a stand. And just so we know, I have. Tall poppy syndrome is actually a thing. It's a phenomenon, and my name's Poppy. Yes, people have hacked that thing off plenty of times. In fact, I have a label. If you Google me, what does it say? Fundamentally impaired, I think I am, because I've challenged the healthcare profession to say your behaviour is genocidal. And I'm not going to point it out when I see it. Do your worst. So obviously, I'm not invited to any of the big clubs. However, as I said to them, I couldn't possibly be a member until you get your shit together, take ownership of it, do better, and help the public have some trust in you again. People like to shoot the messenger. So you obviously do what you want with this message. It's a sincere one, as you'll see. There are people suffering in healthcare coming to us for support, for love, for care, for tenderness, for safety, and we're hurting them. Not even hurting, we're abusing them. Desperate abuse in healthcare by healthcare professionals, and you will know some. Sending love.